agendas here if anybody wants one.
Melody, do you need one?
I'll do actually.
Okay, thanks, Melody. Okay, I'm just gonna do a quick roll call of who's in the room here. And I know I'm recording, so that should hopefully, do we need to do anything besides that?
Oh, I'm sorry, don't.
Besides just recording, I think we're all set up to automatically do it.
Yeah.
Okay, so we have online, we have Carmen Stagmiller and Barb Schaefer. In the room here, we have Gary Dale, Laura Weir, and Ken Bassman. And then from the health department, we have Katie Adams, Claire Hotchkiss, and me, Melissa Moyer, and Melody is here with the Akenta. So, first item on the agenda is approval of the minutes from the September meeting. Thanks, Laura, for sending those out to everybody.
You're welcome.
You do a nice job of them.
I don't do them. I send them out.
Somebody does a nice job of them.
I don't know who it is, but it's not me. Thank you. That would not be me.
Accept the credit.
Yeah, I know. Then you might have expectations.
So if we can have a motion to approve the September minutes.
I would just, the ACIP, is that acronym spelled out in there? I think on the minute, I skimmed it right before coming, but I would just flush out the ACIP or whatever, Advisory Council for Immune Practices, whatever.
Yeah.
I think if it's not spelled out in there, that would be the only thing.
Thanks.
Advisory Council for Immunization Practices. That's
Yeah.
what it is, yeah.
Okay. We can make that adjustment in there. Any other comments or changes to the minutes?
Move they're approved.
Okay.
Second.
Okay, Gary seconds. All in favor?
Aye.
Aye.
Any opposed? Okay, sounds good. We will approve the minutes. I will I will make that adjustment in the minutes, and then Ken, I might just have you, Ken and Laura, these are really messy from our printer. I might just have you guys sign off on the last page of that, and then I will adjust the first page. And then also I failed to get you guys to sign on the June minutes, which we did approve in our meeting. If you guys don't mind signing a copy of that as well. Thank you.
Yeah, it's fixed now.
Okay, I didn't really have any old business to bring up. I didn't really see any in there. So just to move on to new business. There really isn't a lot of board business for this meeting. I think one thing that we should consider is the state is rolling out some updated guidance on Board of Health bylaws. It's been, I don't know, 10 years since we've updated our bylaws for this board. So I think that might be something that we want to look at in the new year. But I don't have anything prepared to really talk about that today. I think we can base it off of the guidance that the state health department kind of assists us with. But that's more or less all I would have for board business. Yeah, go ahead, Laura.
So, do you know, during the Montana Public Health Association conference, they're going to have board training?
They are. They just announced that they're going to be doing another Board of Health training like they did at the last conference. So that is in April. I don't know the exact dates off the top of my head, but Laura and Barb attended last year, and it was a specific series of sessions for Board of Health members, and so it was great. It was Board of Health members from across the state, county commissioners, folks that are part of the Board of Health, and I thought it was some meaningful training.
Oh my gosh, I that's what I was asking. It was really, really good training, and people were really excited about the information they got, and I think it really clarified their sense of purpose. And so I would really recommend that you folks, try to attend. And are you going to have any money to?
I would say we will figure it out. If anybody wants to attend, we can definitely pay for travel and cover a hotel room. Last time it was like, was it just a 1 day or was it 2 days?
It was like a day and a half.
Yeah, a day and a half for Board of Health members. So at this time, it's going to be in Billings, which is a little further away. A little further than Helena, but would you mind looking up the Confluence dates? Yeah,
That's
somewhere,
what I saw.
yeah. So if that is, I will send out more details on what is coming out for the agenda for, the Board of Health track. And if anybody is interested in attending.
Like I said, I'd really
It's great.
recommend
It
it.
is.
It gives you some clarification, more information in regards to what your role is and how important your role is.
It's April 14th through 16th.
Thank you.
Yep.
Thanks for bringing that up, Laura. Any questions about that or any other board business you guys want to talk about today? Okay. Sounds good. We will hop down to communicable disease. So Katie, do you want to start with giving us vaccination numbers?
So, I'm gonna pass this around. This is an easier way for me to visually track our data, so I broke down how many people we saw between the month of September through October 15th, which was kind of the end of our big clinics. And so the whole month of September, we saw 91 people. Historically, we've not opened up flu shots with Marcia in the month of September, but Dawn went ahead and did some when she was in office, and we did just under 100 there. And then as you see, there's kind of a ramp up period. That first week of October, just 3, then the next week 1, because we knew these clinics were coming, and so we kind of, so the ones that say office, this was outside of the ones where we were going and visiting people, so the capacity we had outside of those clinics is represented by those smaller numbers in office those weeks. But for a total of 691 flu shots in what I would label as our like main flu clinic season.
Mm-hmm.
We're still getting flu shots and COVID shot, giving them. There's still people getting them, but for our like bulk, fast-paced, this is what the majority of the shots are. 691 were given out during that window. Yeah, and then along with that same conversation, so this is the first one I'm going to pass out. This is last year's numbers. And then the second one I'm passing out is this year's numbers to today. I just ran right before I came this morning. And
Melody, do you need the copies of it?
Yes, please.
Oh.
And sorry, I accidentally gave you my copy. Can I steal one of those? Okay, thanks.
I'll take them at one.
And then, so if you look at these yearly, this is just my billing summary. And so, a quick glance, we've done $75,000 less in immunizations this year. Partially,
How much?
$75,000. $75,000. Partially because last year was that RSV vaccine, which is an expensive vaccine, and everyone was getting it for the first and only time, so that accounts for some of it. But just so you can see the difference in revenue from last year to this year, and just the change in the vaccines. Yeah.
Did you mention how these numbers compare with last year?
I did not track data last year because it wasn't,
That's okay.
yeah, that wasn't my.
The flu numbers?
It's close based on how
Yeah,
much we
so
ordered.
I can speak to that kind of. And I think, and you didn't pull total that we've given so far.
No,
for
this
COVID.
was just
This is just
through-
through October. So we
Yeah.
have given a significant number of flu and COVID vaccines since we finished our community clinics.
Yeah.
So I would guess that we're probably, closer to the 800 number right now, which is pretty comparable to what we've done in the past. In terms of what we've ordered and what's still sitting in inventory in our refrigerator. So our COVID, we started with 300 doses of COVID and we ran out in the flu shot clinics and ordered another 50 doses. And I think I put in 2 more orders for COVID vaccine since then. So the COVID vaccine has been moving, which is great. We weren't really sure what the community uptake of that was going to be this year, but we've seen pretty good uptake of the COVID vaccine. The flu vaccine, surprisingly, sorry, I'm just going to make sure this isn't, surprisingly, we ordered 2 types of vaccine, the flu block, which is a higher antigen dose, and flu zone, which we give to everyone, children up to age 6, through age 64, basically. And I reduced our numbers a little bit, anticipating some decline in flu vaccination this year. What we're sitting with is actually a lot of the flu block, which surprises me because it's usually our older population that are the best vaccinators. So I'm not exactly sure, like without actually pulling the numbers to see how many people over this age of 65 we vaccinated, it's hard for me to say exactly what's going on. I just know that like we're almost out of the flu zone inventory in our refrigerator, and we are still sitting with a fair bit of flu block, like probably around 100 doses. So I don't know if that means, it doesn't necessarily mean that people aren't getting vaccinated. It might mean that they went and got their vaccines earlier elsewhere, went to pharmacies, there's better access. Fairfield pharmacies now vaccinating people, like there might, and some of our clinics are offering flu vaccines to their patients also. So that could just be an indication that access to flu vaccine is better than it was. I know that access to COVID vaccine is still low. In our community, like we're really the only provider. I don't believe anybody else is carrying it, and so I think for that reason people still come to us for that, but they could be getting it elsewhere. So I don't, without running the reports on, based on age categories, I don't know exactly what the picture looks like, but that's kind of what we're seeing. So I think, it'll probably be fairly similar at the end of the day, like end of the season, in terms of our vaccination numbers, possibly a little bit lower in the flu category than we've seen in the past.
Yeah, I was just curious if there was any influence, if there was any impact in regards to local vaccinations regarding what the message from the federal government is.
Yeah, this is what.
The report file that we were talking about, that we were using to talk about some of that the other day. I don't know if that's helpful to you.
Yeah, I'd say it's really hard to say. And I don't know that it's had the biggest, I think those who go get their flu shot still go get their flu shot, honestly. I don't know that it's had a big impact on flu and COVID vaccination. I will say that and again, it's mostly anecdotal, but we're starting to notice maybe some differences in pediatric and routine childhood vaccination. And this isn't like new, like, starting in January this changed, right? Like this has been ongoing for years, that we've seen an increase in the number of people that are doing alternative schedules or picking and choosing which of the recommended routine childhood vaccinations they're using, that kind of thing. So I don't know that it's really hard to say. And then the other piece of that, and I know we've talked about this before, is that the schools no longer report aggregate data to the state, to the federal level, and so it's really hard to see where our numbers are sitting in Teton County. Like we have access to the data of the people that the health department vaccinates, but we know a lot of people go get vaccinations at their pediatrician office in Great Falls. And so just because, the numbers that the health department is giving are low doesn't mean that that's what it looks like across the community.
So do the schools still maintain vaccination records on their children?
They do. Yeah, but they do, and they are required to have a vaccination record or an exemption on every child that's attending the school, but they no longer have to report that to the state.
I see.
So that's where, and because they don't have to make that report, I think they typically don't. Like I don't think it's a high thing on their priority list to go through all the vaccinations and make sure that everything is, in place, or kind of compile what that looks like.
Well, they may not even know what they're looking for.
Well, I think that's a big challenge, and we have in the past gone out and helped them do that, and it's still a standing offer that we will go out to the schools and help them look through their vaccination records, and if it's helpful to organize that and help them sort out who might be behind on things and which parents to reach out to. Because I think what we saw during the pandemic was that sort of stopped happening. Like, kids were remote, or they're just with everything that was going on, parents weren't bringing their kids to the doctor for routine medical stuff because people were just staying at home. And we saw, as a result of that, particularly like in the adolescent realm, there were kids that, they're supposed to have a TDAP entering into 7th grade, and there were kids that were making it to, their junior year of high school before they're like, oh, I should have had a TDAP, like it just got missed during the pandemic. And so I think that is still, we're still dealing with the consequences of that in terms of sorting out vaccination rates and getting kids back on track.
Could I ask one more question?
Sure.
So there's no requirement for a minimum immunization in with students? You don't have to have like 4 DBT, 3 polio?
Yes, no, I think the technical way that this is worded is there is a minimum requirement of vaccination, and also religious and medical exemptions are accepted.
Oh, okay.
Any other questions about vaccines? As far as actual flu and COVID numbers go, we are definitely starting to see it. We've had, since I would say September, we've had a trickling of COVID cases in the community. We have seen an uptick in the last 3 weeks of COVID cases that are getting reported to us. I would say our reporting partners, our clinics, everyone is doing an excellent job of reporting through our surveillance systems. We sort of changed that process this year going into this flu season, and it seems to be working pretty well. You guys, I think, are included on an email that I send out to all of our key surveillance partners, and so I get responses back from those partners to that email, and that seems to be working okay. So we have seen, like I said, COVID cases. We have one outbreak in a congregate living setting right now, and then as far as flu goes, we saw our first cases of influenza A last week. Last week we had 3 cases of influenza A, and so far this week, as when I left the office yesterday afternoon, we're up to 5 cases this week. So influenza A is moving around, and we are now seeing that reported from like multiple communities too. So not just concentrated in any one community in Teton County, but multiple people living in multiple communities in Teton County have gotten a positive flu test. So yeah. So yeah, go ahead, Carmen.
We had 3 positive influenza A's yesterday.
Okay, I don't know if I got all of them from you. Okay, so there's more than that. So more than 5 so far this week. So yes, influenza A is ramping up, and we are going to probably be seeing quite a bit of it over the next few weeks. It's a good time for the schools to go out on holiday vacation, I would say.
Good gathering in groups.
Yeah, yes.
Is there any sense that if there are 10 reported, how many unreported there are?
Oh, that's such a good question, Ken. I imagine there's probably some like national estimates of what that looks like, but yeah, it's a fraction. It is like tip of the iceberg compared to what's out there, because there aren't that many people that go see the doctor. They have to feel pretty crummy to go see their provider for flu. Wouldn't you agree with that, Carmen?
Yeah, I think the grade school had like 55 kids out yesterday, and we saw, a fraction of that and get 3 positive, so.
Yeah, so it's we know when people are sick enough to go to their provider for flu, we know that there's a lot of flu in the community. Yeah.
Thank you.
Yep. Okay. And then in terms of measles, so there were 2 weeks ago there were 3 new cases reported in Gallatin County of measles. There was a HON that came through, and I sent that out to everybody, but widespread exposures all over Gallatin and Missoula County as it resulted from those cases. So it's just a good reminder that like it's still there kind of under the surface. Those cases can pop up. We have been on, Gary's saying standing orders for us to be able to offer an accelerated schedule for kids, but the way that those are worded are really only if there are cases in neighboring counties. But then Gallatin County issued a recommendation that anyone traveling to Gallatin County, vaccinate on that accelerated schedule, given that they have that kind of community transmission going. So that's kind of out there right now, a recommendation for traveling, if you're traveling to Gallatin County. So anyway, just measles it's not done.
So Missoula County didn't get any reported cases out of that exposure, right?
Not
So
yet.
far as you know?
Yeah.
Yeah.
As far as we know, no reported cases yet.
Lucky.
Yeah, fingers crossed.
Good vaccination.
Any questions about communicable disease? Okay. You kind of already talked about Bill.
I have a little bit more
Okay,
about.
go ahead.
One thing I was going to say is, so historically, our billing is starting to get shorter and shorter on the turnaround for flu and COVID season, and so we saw this time it was all done by the end of October, which is like 2 to 3 months earlier than last year, and so we're seeing a turnaround of those monies coming back at a faster rate than I have time to deposit almost, because of how many went through so quickly. So the number of the money back is actually higher than what's there. I just, my capacity is limited at the same time to get that in as fast as it comes in sometimes. So that's all. It was just, the EHR is great. It's making things really more efficient. Okay. Yeah. Unless there's questions or thoughts, I guess. And then, do you want to talk about that?
Yeah, so do you guys, so I just want to double check with you guys and make sure, are we okay to talk about, because we can push these step plans, but if everyone feels okay to talk about them today, we'll just get them done?
I had said no, but I did get through them, so I'm good.
They are the most robust ones. We tried to do shorter ones for the
Pardon?
truck.
Yeah.
The truck and chem were not the longest, because I am currently working on the caring tree. Last week was the food pantry, and the week before was something else. And so
But you had the best volunteers.
I did. It's been great. It's
For
really
the
been
food
been an
pantry.
efficient year and fantastic in so many ways. I just. Yeah.
When you have a lot of
Thank you,
work, you
Katie.
just said a smidgen of what's required.
Thank you.
All that to say, so I'm sorry it took till yesterday to get that chem
That's
packing
okay.
truck. I kept getting called about some other stuff. So I went through both of these and changed a few things on them. There was a few just mostly updates to the appendix. There were some out of date numbers, so I changed out that, and then some just some formatting things that I fixed on the ChemPack one. And then the truck rec plan, same thing. It was like some formatting things that I changed to match other formatting things, and then I pulled out a couple of the newest versions of the agreements that I can find. I have, I'm gonna still look for, see if there's any more current guidance for law enforcement. That was the one that I couldn't, as far as I could tell, I couldn't find one. But I'm gonna continue to look for one to see if there is, but so not a crazy amount of updates to those two plans. They're fundamentally the same, not really changes there. And then the COOP plan, that one was a little bit more changes done to that one. We added in a few new things to that one. And again, it was like a lot of formatting. We want all of them to read the same, so that when you pick up one plan, you know the format for all of the plans is kind of the idea there. Any questions or any things you want to point out in particular about those plans?
Yeah, I think the
Sorry,
COOP plan was, the biggest
was
changes, and we actually went through and had each of our staff kind of look through. The COOP plan is basically like, okay, so if we were told you can't go back into the health department, you got to be able to provide all these services elsewhere, how would we do that, right? And so that was a pretty good exercise for us to actually go through and think about, like, okay, what are the things we're going to grab, so that we can go set up and do elsewhere. So each of the programmatic staff kind of went through and built those lists on what exactly they would need to be able to continue to offer our programs. And I honestly feel pretty good about it. Like, I think we've had some discussions about how this is actually a pretty helpful tool for us.
It looked good. I read through that one.
Yeah.
That was 17 pages.
Yeah, it's a lot of checklists.
I know.
It's a lot of checklists.
Checklists are good.
Yeah.
Yeah, you know, it's funny because I was, when I was public health director, I started writing these plans and I found, I can't remember which health department I found, because a lot of people's plans, I looked at plans, because, you know, everybody knows here I hate to write and can't write very well. And so I was looking for someone to plagiarize, just, you know, change it so it would fit Teton County. And then I came across this one format that I thought, this is it. This is a great format because it's separated, it's divided up. A lot of people just had paragraphs. And so I'm so happy to see that you're still using it. It works well, doesn't it?
I think, I think we've been pretty happy with it. We've
Yeah.
been like slowly moving all of our plans to this format, so, yeah.
On the truck wreck protocol, when I skimmed that, I think Steve Rose's name was still in there.
listed.
And then, I just had a question on Appendix B. The header on that, it's a 2011 document. Is there an update to it? Because it's got Schweitzer as a governor and, you know.
Yes, that's the one I'm looking for.
Okay, all right.
Yeah,
That's just.
so there's like, yeah, that's the one I couldn't find.
Oh,
I'm
I
working
didn't
on
know,
it.
maybe
I
there's not an
Googled
update.
for like an hour and a half. I called 2 other jurisdictions and got no callbacks. And so that one I'm working on. But
that's good.
after an hour and a half yesterday, I was like, okay,
I mean, it's entirely possible it has not been updated.
It's
since-
probably not, yeah.
Like-
I mean, it's a fine document as
Yeah,
it
this
is.
is
It's
literally
just-
the only one I could find. So like
Yeah.
I pulled up, I even got like the state has a few in their database, and I was like pulling those ones up. I pulled up Rivales counties, I pulled up Helena's, and like they didn't have, like some of them didn't have this.
Oh,
Theirs were slightly
yeah.
different. Or the ones that I did, like this is just like kept pulling up over and over. So I don't know if I'm not using the correct words in my Googling or what, but I'm hoping to get some phone calls back and fix that one to see if there is a newer one for that. And then I'm sorry, I missed Steve's name on there.
Oh, you got it.
Oh, but I did change the phone numbers. They are Deb's phone numbers, not Steve's in the paper. Where was Steve's number or name at? Was it in the part where it's who was given to?
Oh, it's,
Because
It's in the history of edits, so I
Oh.
looked for it after that. It was in, if you look through the document
Oh,
history,
okay.
his name appeared there, and I didn't.
yes,
didn't know.
it's actually still it's Deb's number, the cell phone number in there. So it must be the DES cell phone, not Steve specific.
Yeah, okay.
Okay, but yeah, I will change that though. Thank you. Thanks for catching that.
So when I was reading through these, I was curious, what role does the Board of Health have in these plans? Because there was never really anything specific about the Board of Health. It was like his position and then the hospital physicians and things like that. So I was just curious, maybe.
well, I think that the role of the Board of Health would be to, I guess, twofold. So one is to help us review these plans and make sure that, like, yes, the Board of Health, which is the public health authority for Teton County, agrees that this is the protocol that we would use, right? So it kind of gives us the authority then to say, okay, in this situation, we can follow this plan and we have the backing of our Board of Health to do it in this way. So I think that's one part of it. And then I guess the other piece is if the, you know, I mean, if something ever did come into question, or if we ever did have to have a board decision related to how one of these was implemented, like that would come to you guys and that would be a discussion that you guys would
A good
have.
example being COVID.
A great example being COVID. Like that was a good example of how we used like parts of our pandemic flu, parts of our communicable disease response plan, right?
Yeah.
Yes. Yes.
And the board was involved. The decision-making was helped
Yeah.
by the board.
Right, yes, exactly.
Involvement,
There's
and that
like
plan for them to-
non-pharmaceutical
yeah.
interventions that are
Yeah.
written out in those plans where you use things like canceling community events that then came to the board and the board had to make decisions on.
Yeah.
If Ken remembers.
Ken, were you on the board then?
Ken's been through it all.
A big one for us is the
Hey,
rodeo.
Ken, your hair's still dark.
So yes, that's a great example, Laura, of where the board might come into play. So I think that's why we review with you guys. Honestly, for a time there was like, we receive a FEP grant. The FEP grant tells us to maintain a set of plans. And for a time there was a requirement through the FEP grant that we bring these plans to our Board of Health That's not really a requirement. In some circumstances it is, but it's not really a requirement anymore for our FEP grant. We just feel that it's good practice to look at these on at least an annual basis to say like, okay, is this still applicable? Are we changing the names that need to be changed? Is this up to date? And so it's helpful for us to pair that with reviewing it with you guys through the board.
Well, if you ever have to use them, it looks like you're on top of it. When you don't have someone's name in there that's maybe not even around anymore.
Right, yeah. It's a good question. Okay, well, we don't have to vote on those at all, it's just a review, but any other feedback on any of those 3 plans? Any comments?
with them.
Okay, great.
Because I really appreciate the feedback, because I also struggle with writing sometimes, and sometimes it gets really drowning in some of these plans, so I appreciate the eyeballs.
Okay, I'm gonna let Claire take it away with some behavioral health stuff then.
All right, so Teton Cares, along with MSU Extension and the Health Department, and now fiscally partnered with the Shoto Lions Club Foundation, we are putting on an agricultural conference, a 1-day conference. It's a wellness and education day. So we are currently, and if you guys want to see, I do have a sponsorship letter that was written out to go to different businesses that are a big part of the ag community. The goal with this is to reach our agricultural community and help tackle some of the mental health struggles that they might be going through or stressors. We talked with Deb at the last CARES meeting, and they are seeing increased numbers in emergency calls that are specifically mental health based. And so our thought was to create a 1-day conference that's a little bit about connection and community, as well as education. And behavioral health is going to be layered throughout some of these topics. We do have a specific speaker. Her name is Darla Tyler McSherry. She's going to be doing what's called Ask in Earnest. Ask in Earnest is a farm and ranch based suicide and depression training. And she is a farm girl from Lonesome Prairie, Montana. I don't know where that is, but I believe it's very small. And she lost a very close family member to suicide, and so this is a very big passion project for her. So she's excited to come back here. She has been here before in September to do a training for our CARES group. We also have a financial portion, land and legacy, or estate planning. Jane Woolery is going to be doing her Fences program, which the acronym is Families Engaging Nicely. I need to look it up, it's a long one. Families Engaging Nicely. I can email you guys the rest of it, but it's a very interactive program, and so you watch a video and then she does a discussion as well. It's a very, very meaty day. There's a lot going on, and we're really excited about it. So we are focusing, this is going to be in Teton, and we are basing our speakers around Teton residents and just what we've heard the ranching and farming community talk about. But we are reaching out throughout the north central region to see if people would like to come. So I reached out to newspapers throughout different counties. We've talked to different health departments in the other counties to let them know what's going on. I've talked with my network of prevention specialists as well to let them know about this. And so we are really hoping to make this a sustainable project that can continue on in the future, which is why we are partnered with the Shoto Lions Club Foundation, so that we can keep funds in a specific spot, and it's really easy to take payment because there is a small fee, and really that's going back to paying for the speakers to come, covering cost of travel or lodging. There are some MSU Extension agents who are going to be coming and talking. Mm-hmm. We also are providing childcare. You do still have to pay for childcare, but we are working with CYA to do the childcare for 0 to 5. And then Shelby Jones from MSU Extension is going to be doing a day camp for ages 6 to 12. And we just completed a babysitting boot camp. And 6 of the girls who completed that boot camp are signed up to work with Shelby at the day camp or help out with the childcare portion. It's going to be a catered lunch with Feisty Fork Baked Goods, which is Kelsey Sweeney. If you had her stuff, you might just cook for that. I don't really know. We also, at the very end, and it's not on this specific flyer because we have like 12 or 15 flyers that we've been making for this. We are going to have a free community music event. So Eric Fingers Ray is going to be coming.
Jeez, Mo, you've really put a lot of work into this.
Yep, and he's going to be coming, and that is going to be a free event for everyone. So we're going to let the schools know because there is, I think, a basketball game that day, and believe everything should be done by like 7 o'clock, which is when he'll start. So we're going to just try to get the message across to everyone, and hopefully help a few people right along the way.
I would say that this project is, we've been talking about it a lot with state partners, and it's getting a lot of attention as, a potential type of strategy to really pull that agricultural community into the conversation around mental health in a somewhat, I guess, less direct way, right? To make a worthwhile conference for them to come, and also bring in the conversation around wellness and
Resiliency.
Resiliency.
And just tips and tricks and how to talk to neighbors if you notice what's going on, if you're concerned. We also have the state vet coming, and she is going to talk about the highly pathogenic avian influenza, which can affect animals as well.
Yes,
So
people.
have you had any registrations yet?
We've had a few.
Yeah,
Yeah.
and so at this point, that's really the piece that we need is we need people to sign up, we need people to attend to make this a worthwhile endeavor. But I think it's going to be a really great day. So, tell your friends.
Yep. And Jen Swanson is one of our planning partners. Jen Swanson, myself, Shelby Jones, Dozer, and then Melissa. And so what Jen has said is you'll get a lot of signups maybe a week or two before, and that's only going to be half the people because then you're going to have people just show up. So
That's
trying to
her
get numbers.
experience.
Yeah, that's her experience, and she's got some good experience.
It's gonna be the guys that are checking the weather sites before
Yes,
they travel
yes,
that weekend.
So you're hoping to get not only people from Teton County, but also Pend Oreille and Toole and Glacier,
Yep, we're hoping for
Or even Cascade.
I think it's open to anybody who
Yeah.
wants to attend. People can travel from wherever to come if they want to. We are focusing our marketing primarily on North Central Montana.
Do you
Yeah,
guys have any questions about it?
and then I think the hope is that if it goes well, this is something that we can continue year after year, and also potentially creating a template or a model that other communities can duplicate in there, so that little conferences like this could be happening across the state.
And this idea kind of sprouted from the Department of Ag used to put on what's called the Young Ag Couples Conference. And it went on for, I think, like 17 years. And there were probably many reasons why it ended, but among them was the person who was putting them on retired. So it was also a much bigger conference. It was about 2.5 days. And I think quite financially pricey for them. So we are trying to take that and make it just a little bit more feasible.
So can we share this?
Absolutely.
Sure.
Yep.
Yeah.
If you guys want, I can include it in the email as well.
Can I have this one?
Yeah.
You can have all of them, Laura, if you want.
Or you can swing by and look for you.
Do you know Eric Sommerfeld?
I don't think so.
Oh, he's big in Farmers Union, lives on the east side. You know Eric Melody, don't you? I'm going to share it with him.
Yeah, that would be great.
Maybe that Brian Schweitzer's brother, Walter.
Well, MSU, one of their goals, I think, this year is to really reach out to lawmakers and policymakers. And so I believe Jen and Shelby have reached out to a few of our area, right? I think like Zach Worth, I can't remember some of the others, but reaching out to see if they would be willing to come and, across party lines, because this is an issue that affects all.
And I guess the last thing I would say about this is that this is a project that Claire has been talking about since the day she was hired. This has been a vision in her mind for a long time. And it never really felt feasible or realistic for us until we became a recipient of the Near Term Initiative 11 grant. So that funding that came out of the governor's office for the Future Generations Behavioral Health stuff is allowing us to, do the lift that it takes to get something like this.
Well, and then look what's happening in agriculture
Yeah. Yeah.
at this
absolutely.
moment. I mean,
There's a lot.
Did you
Yeah.
write the grant, Claire?
Do
I mean,
what?
who wrote the grant for
What
the
was that?
application for the money?
For the near term initiative, yeah, I wrote that, or we worked on it together, but
Yeah,
yeah,
well,
yeah.
good for you guys.
So, and then,
So all the credit is due
All
to
the
Laura,
credit.
is the point of that, sorry.
and then the second thing I do want to share, I don't have a flyer or anything yet ready. I've been working on a draft, but I reached out to the Department of Justice, the Montana Division, and one of our schools specifically have been asking to have a training on essentially internet safety, especially in the AI world. And the Department of Justice coordinator, who I needed to get a hold of, called me back. So his name's Brian Gortmaker. He is sending his team. They are also like forensic scientists. They are coming out to Shoto to do a junior high and high school presentation January 29th. It's a Thursday from 1 to 3. And then we're going to have a community presentation / training that evening. It's about a 2-hour training. And so what they do is they tailor it a little bit different for the kids versus the adults, but they will take maybe a teacher and they will gender swap and they will try to fish and they try to show kids how very easily someone can get access to their social media, maybe their email, just contact with them in general, and just how easy it would be to manipulate a situation. And
wow,
so-
that's great.
Yeah.
Boy, we need that bad.
And so the training, I think, is a little bit more in-depth for the adults. They don't want to terrify the kids.
Yeah.
Right? We want to share truth and we want to be honest and we want to share facts. And at the same time say, like, if this happens to you, here's what you do.
Well, it's not necessarily terrifying the children, but it's finding they may recognize their vulnerability, even though they're not. They don't recognize that word. These individuals are very sophisticated in regards to how they get these children continue to interact and then interact and then move on from there.
Yep. And I think that when I was talking with them, it's not that they want to scare kids so that you don't do it because you're just too scared to do it. You want to give them the information, as scary as it might seem, so that they can make decisions in the
Make
future.
good decisions, yes. And
that are going to be
I wonder if
helpful
this
for
is
them.
what they were talking about,
Mm-hmm. And so he's coming out, and I have had 2 other schools sign up. So Dutton signed up yesterday, and Fairfield is signed up as well for the same week.
And we're going
he-
to try to partner with Dutton and Power to maybe do that
We're
as
gonna try
one
to
combined.
partner with Dutton and Power, and then I'm going to talk to Fairfield and see if Greenfield students, because it's for junior high and high school, if the junior high in Greenfield can go to Fairfield for this presentation.
And I would say this is something the schools have been asking for quite some time. Like we've heard this from most of our school administrators that this is a really big concern for them with their students, and they would like some education and training. This particular presenter was one that Bev Yeager at Shoto Schools had her eye on, but I think just ran out of the capacity to get it scheduled, and so passed it off to Claire, and Claire has then been able to run with it and get it to other schools in our county as well.
Well,
which is
thank
great.
you, Claire.
Yeah. You're welcome. And then in crisis diversion with the North Central Crisis Coalition, we are continuing to work on bringing trainings for EMS and other first responders. We actually did add working with them into the CARES strategic plan, which we are finalizing as well, and then we'll release hopefully in the next maybe month or 2, next month.
Yeah, hopefully in January.
In the new year. In the new year, we'll get a new plan. Yeah, there's a lot of good work going on right now. Yeah. In behavioral health and crisis. So, and if you guys have seen the surveys, we are sending surveys out to first responders. You might get it from Shelby and they'll.
It came out from me, and actually
Okay.
that reminds me I need to send a reminder email to everyone. But yeah, so Shelby with MSU Extension designed a survey for the entire North Central Crisis Coalition. that was distributed like a week and a half ago, and I'm guessing it'll probably stay open through the holidays, but we've been trying to pass that out to our EMS crews, fire, law enforcement, just to get some feedback on what are their training needs and what would they prioritize, so we can, and this is not just Teton County, this is across
North
an
Central.
8-county, 10 tribal region in north central Montana, so we can start to build a calendar and bring in some trainings in an efficient way, so we can, offer them across the region, but make sure that the jurisdictions are connected to each other, so we can kind of leverage those resources when it comes to getting trainings done. So,
Did you send it to search and rescue?
I did not send it to search and rescue, but if you think that they'd be
Yeah.
interested, I sure could. Yeah, I will do that when I get back to the office. Who's the head of search and rescue? these days?
Ben Rhodes.
Ben is, okay. I did send it to Ben, so maybe I'll just, for fire, so maybe I'll just email it to him again and say, can you send this out to search and rescue? That'd be great. Okay. Any questions on behavioral health stuff?
Thank you. This is great. This is great news.
And then I guess the last little update that I have is, so the county is contracted with, we have a contract sanitarian, his name is Van Puckett. He is, I want to say he's out of Marr County. But he's been great. He's been easy to work with. Most of the communication, like sometimes communication for sanitarian comes to the health department, sometimes it goes to Brian Colesworthy or might come into the commissioners. We've been funneling that to Brian, who's been passing it over to Van, and he's been really responsive. There's a few things that we've needed for deliverables that he's been able to take care of. I know he was up once to do some inspections, but Austin honestly got actually all of our food service and pool inspections done before he left. So there really hasn't been, but since Austin left in August and between the first of the year here, there really wasn't much to do in terms of inspections. Everything had more or less been accomplished. So so it's been going pretty smoothly. I think it'll continue to work. My understanding is the commissioners are still looking to hire a full-time permanent sanitarian if we get applicants. So the application is open, or the job posting is open, if anybody knows anyone who might be interested. But in the meantime, Van and his team have been great to work with.
Well, that's good news too.
Yeah.
A lot of good news.
Anything else that you guys wanted to talk about today? Anything from you guys online, or?
Did Austin sell his house? Not that I.
It is. I think they close on the 22nd.
Is it the
good.
sort of the pink house across the street from yours?
Yeah.
That's his. Oh, okay. I always wondered which. I knew one of those was good.
I think it's time to, I'm a crusty old hard of hearing pathologist. I think it's time to start looking for, you got these new young providers that see living patients in the community, and I think one of them would be more appropriate for a health officer. So, I can hang on till you get someone
Is it
that's.
find one then?
Yeah.
I mean, obviously, I had to scrape the barrel to find a little guy right after COVID, but
Gary.
we got health providers in the community that are pretty good guys I've talked with that have kids, and I think and I've kind of planted the bug in the ear a couple times, but I think ideally, like around springtime, maybe. I think they should start looking for a health officer because they're going to be permanent residents of the community, it looks like, so we're in a good situation, I think, so.
Okay. Well, we'll talk about it, Gary.
Okay.
They have
I'm
to.
putting it out there.
They have. So you have a concept of public health, and you support public health. There are some health care providers that I recognized during the COVID situation that didn't, support the public health efforts. And so we have to be conscientious. We don't appoint someone like that.
Well, that's up to you guys, but I'm just letting you know that I think, I'm not, there's no health crisis or anything, but I just, yeah.
Oh, I appreciate that you came on board. and-
Well, I've learned a bit being in here, but yeah. You know, I'm a pathologist. I dealt with, my dealings with public health prior to this were on the lethal end of public health. So I had an appreciation of things. So.
Well, you did.
When I was the one picking up and calling the health department, reporting stuff. So anyways, this has been an eye-opening. It's been a good experience, but I'm just encouraging, and the commissioners, I think, you know, they support it financially too, and I've not looked into it from that point, but I think that's more attractive for these younger providers you got.
Well, you know, I was thought, you know, when Dr. Bob, is that his name, Bob or Bill? He came that one time.
Jeff?
Oh, Max, that was really
Dr.
off.
Max?
You got, yeah, he's got kids,
He-
and
you know,
Troy's got, yeah, anyways.
I wonder if he would
just-
be interested.
yeah,
You know, he
well,
came.
That's up to you. I'm just putting it out
Yeah.
there, guys. I mean, I think I'm happy to help in as best I can. but-
Well, we appreciate you.
Yes, we
Gary,
do.
so- Okay, well, if there's nothing else, then we will adjourn our meeting.
5 minutes.
Thanks, everybody.
Thanks, Melissa.
Thank you.
Thanks.
Thank you,
Marty,
Melissa.
Barb.
Thanks, Clara, geez.
Yeah.
A lot of work. And Katie, geez, yeah.